Hi, everyone, and welcome to the CSU Prevention Extension Cast. I'm your host, Dr. Nate Riggs, and I'm happy to be joined by Greg Pliler, who's a Prosper Network Organization Manager from Iowa State University, Dr. Alex Elswick, Assistant Professor for Substance Use Prevention and Recovery at the University of Kentucky, and our very own Joy Akey, who is an Area Extension Agent in Family and Consumer Sciences in Yuma County, Colorado. I hope you all are doing well today, and thanks for joining. For those of you who have yet to join us for a Prevention Extension Cast, I'll be moderating a 45-minute Q&A with Joy, Greg, and Alex about the Prosper Prevention Delivery System. And then after that, we'll have some time for our guests to respond to any questions that emerge from the audience. So throughout our conversation today, please feel free to enter those questions into the Teams live chat, and I'll relay them to either Joy, Greg, or Alex near the end of the call, or the cast, excuse me. But before we get to all that, I'd like to thank the National Institute of Food and Agriculture for providing funding for this Prevention Extension Cast. In fact, we'll be streaming this webcast 12 times over the next 2 years on prevention-related topics. And what we really want to do is to make sure that as many of these topics are driven by you, our audience. So if you wouldn't mind, please drop as many Prevention Extension Cast ideas that you can think of into the chat. They could be related to state and national trends in substance use, mental health, behavioral health, evidence-based prevention strategies, substance use among special populations, you name it. And we'll try to find somebody who can come talk to you about it. Now, the first topic that we'll be discussing today is the Prosper Prevention Delivery System. And the three folks that I have here joining me today have a ton of relevant experience with Prosper. Now, Greg Pliler is joining us from Iowa State University, where the Prosper model was initially conceived. Greg spent the past 18 years working in the field of substance misuse prevention in a variety of roles, including evidence-based program implementation, coalition building, policy development, strategic planning, and evaluation, all very relevant to Prosper. Now, his work has provided him with a unique perspective and experience with collaborative community efforts and barriers to effective and sustainable program implementation. Dr. Alex Elswick joins us from the University of Kentucky, where he has been involved in early efforts to bring Prosper to his state. Now, Alex is a tireless advocate for people with substance use disorders. He currently serves the University of Kentucky as an assistant extension professor for substance use prevention and recovery. Alex's knowledge and experience with addiction is multifaceted, and his professional experience, nonprofit work, and research agenda all focus on long-term recovery. And importantly, Alex is himself a person in long-term addiction recovery, so he shares the lived experience of many with whom he works. And then finally, Joy Akey is a Colorado State Area Extension Agent serving the 5-county Golden Plains area. Now, most of Ms. Akey's programming focuses on health, nutrition, and food safety, but has really appreciated the opportunity to pilot Prosper in Yuma County here in Colorado because it has opened numerous doors to focus on behavioral health. So really emerging public health, behavioral health issue. Now, Joy is the local team leader for Prosper, and she is also a trained facilitator for Strengthening Families 10 to 14, which is a big part of Prosper as well. So thank you all for joining, and I'll get started by asking Greg a couple of questions. So Greg, would you mind telling our audience a little bit about yourself, including what your role is in the National Prosper organization?
Sure. I'm the Prosper Program Manager at the Prosper Network Organization, which is the Prevention Partnerships and Prevention Science Institute, or PPSI, at Iowa State University. So a lot of names, a lot of acronyms there. But basically, I oversee all things Prosper. We work with our Prosper partner states as a network together to implement evidence-based programs and the Prosper delivery system. I think to tell a little bit about myself and my background, I have to go way back, so I'm going to try not to bore anybody, but it really my story really explains why Prosper, and I think you get the idea of why it's so important to me. So initially out of high school, I had joined the military, thought I was going to have a military career, and changed my mind, not realizing what it was going to be. And then spent a few years, did a couple years of college, spent some time with different jobs, but ultimately wanted to get back into the military. And I did by joining an organization called the Counter Drug Task Force as part of the National Guard. And most people aren't aware that the National Guard is involved in substance abuse prevention in communities, but we are. I was going to use my job there as a stepping stone to other jobs within the Guard. But initially, my job there was to provide programs to youth. And the goal was to reduce substance use amongst youth. And we had our own tailored programs. And I had been doing those for a couple years when our organization, we had this conversation where, and I think at the time it might have been a rhetorical question, but they asked, are we doing good in these communities? And is what we're doing helping? And I said, I don't think so. And that probably wasn't the right answer to give people at the time, but it opened a conversation, and it was one of those moments like you have in your life where it was an epiphany, where how do I know this actually works? And so I really changed the focus of the degrees I was pursuing, went to health education, went to prevention science, and I really just dug deep as much as I could at the time in the research and what's going on behind the scenes. And over time, I really learned a lot about what works and what doesn't work. And during that same time, our organization did change over to some evidence-based programs. And what I also learned through the years is, man, once you're actually implementing evidence-based programs, how tough it is for various reasons to actually implement them as they're designed, how you're supposed to do these year after year after year. So that was always something that was an issue for us. We eventually changed a little bit, and our work moved from implementing programs in schools to supporting community coalitions. And in that work, I approached it the same way. What works, what doesn't work, and why does it work? Really digging into the research and what I understood. And that's the first time I came across Prosper. And luckily, Prosper came out of two universities, Iowa State University and Penn State, and Iowa State was just up the road from me. So that's when my partnership and work with them just started. And I really started to learn how Prosper helped teams build a structure so that these programs can be implemented with the highest level of fidelity and the highest level of quality to have the most impact in a community. And sure enough, years later, I retired from the military, and just so happened there was an opening at the Partnerships and Prevention Science Institute, and here I am. But I wanted to be here primarily because I learned and know that Prosper works.
Great, thanks, Greg. So can you tell us about the Prosper delivery system and how is it structured? How does it support local communities in implementing evidence-based prevention programs?
Sure, love to. So ultimately what we want is healthy, happy youth and healthy, happy communities. With that, we do know, and probably everybody on this call knows, that evidence-based programs can help us get there. So we look at a program and we know it has a specific effect in a community. And like I referred to earlier, that's all easy to say. It's a lot tougher to do. So the first part of this is we know that we want to implement those evidence-based programs, but it's how do we do that in the best possible way? And that's what Prosper is. Prosper is the system of delivery around implementing those programs and getting those programs in place. And there's really three issues that we want to address with those. And the first is the quality, which we've already talked about. How do we do it with the highest possible quality? Second is how do we do these things sustainably? How do we keep them going year after year after year? A lot of these things require funding. They require buy-in from the right organizations. So there's a lot there. And then lastly, if we have things like volunteer programs, how do we get people to the table? How do we get families and youth to show up to those programs where they're not required necessarily and that they have to volunteer their time to show up? So in Prosper, we implement two programs. One is a youth-focused program in schools, and the second is a family program that's done outside of the school setting, in which a youth in 6th or 7th grade go with one of their parents to a program over a period of weeks. There's SFP 10 to 14, or Strengthening Families Program 10 to 14, and then Life Skills, Botvin's Life Skills is the program in the schools. So in addressing those, to address those three areas, sustainability, quality, and getting those folks to the tables in the program, we want to set up a team in the community that's led by Extension. And you might say, well, why is it led by Extension? And we'll kind of give an example, but the key thing there is the systems are already in place. It is so much easier to use an existing system, and Extension is across the country in all these rural counties, reaching areas that nobody else reaches. So Extension it ultimately is a great organization to be the team leader and to lead those teams. So we have an Extension-based team leader leading a local team, which is a small strategic team of 8 to 10 people, to make sure that those programs are implemented to overcome those barriers that we have to quality implementation. But these teams don't have to do it themselves. And this is how the university system is so important and why it's so important. They'll have a technical assistance provider from the university or someone else in the university extension that's dedicated to supporting them. And just like I said, they provide technical assistance and they act as a liaison between the state management team, which is another tier of support to support that local team. So not only does that local team and team leader have a technical assistance provider, but they have a state management team that's supporting them and helping them get things done at the local level. And then even above that, we have the Prosper Network organization. And it's the team of experts. We have some of the initial researchers that were on the initial project, almost 2 decades ago, to provide assistance, to interpret the data, to take that information, and to provide any sort of technical support to the state management team or the technical assistance providers, or even to that local team level. And really, it's that tiered support and following the Prosper process and those feedback loops at every level that really help the Prosper delivery system work.
Great, thanks, Greg. I'm constantly reminded of this Department of Education publication that came out some time ago, but it demonstrated that among all of the school-based programs that are implemented for substance use prevention, only 3% are evidence-based and implemented with fidelity. And so what it sounds like to me is that Prosper can support communities in identifying evidence-based programs and then supporting the implementation quality so that communities know that the program is being implemented the way it's intended to for public health impact. So can you tell me, Greg, can you describe how communities can benefit from implementing Prosper, either related to how programs are implemented or impacts on youth behavior, substance use, or family and resilience?
Sure, there's a lot of data, a lot of information that's resulted as part of the Prosper trials. I briefly talked about, 20 years ago when the initial cohort, as part of this, the Prosper project initially started, and they are still following those cohorts, and those folks are in their mid-20s now. And there's not published research yet on the most recent, but those reports will eventually come out, and we'll find out where they're at in their mid-20s. But it's my understanding that there's still, even in their 20s, there's some they're seeing significant outcomes. But I can tell you about through the years, as far as substance abuse or substance misuse outcomes, Prosper has demonstrated substance misuse outcomes all the way through high school and into the young adult years. And they took those initial cohorts and they have followed them, asked them the same questions about their substance use. And throughout those years, even into high school, in both high risk and normal risk youth, they found both of them, it has a positive effect in implementing programs through the Prosper delivery system, as opposed to just programs delivered without Prosper. And now I want to make that kind of clear, because that's always a question and a gray area that comes up. The trial wasn't about whether you're having a program or not. It's whether the programs were delivered through Prosper, and that's where we actually saw the difference. It's not, so these programs have certain outcomes when just delivered in a standard manner. Then they have the outcomes when delivered within the Prosper delivery system. which were improved outcomes. So that in itself is impressive. We saw there's just a host of different outcomes, but primarily when we talk specifically about substance misuse, there was reported reduced use across many of the different substances, whether alcohol, marijuana, and then a host of other outcomes. But one I want to point out in the 7.5 years past baseline, and this one's so important because just a couple months ago, I think the report came out where it's looking like 2020 is going to be a record year for overdose deaths, unfortunately. I don't think that number is official, but it looks like it's getting much worse. So in the 7.5 years past baseline, they saw that the communities that implemented Prosper, if you talked with these youth, so this was self-reported information, had they ever misused a prescription narcotic. And if you had a community, if you were a Prosper community implementing Prosper, it was likely that if your community over here that hadn't implemented Prosper had 100 people that had misused, in your community, there would be 25 less. There would only be 75. So when you think about the opioid epidemic and the issues that we have with overdose, that number just resonates and sticks with me, that we are having that effect on young adults by providing a program in 6th grade and 7th grade that in young adults aren't abusing opioids.
Great, thanks, Greg. So, so that was the last question I have for Greg today. Thanks a lot. That's really important information. And if anybody has any questions that they'd like me to forward to Greg, then please drop them in the chat and we can circle back at the end of the Q&A. All right, so Alex, you're up. Can you tell the audience a little bit about yourself and how things with Prosper got started in Kentucky?
Absolutely. Well, good afternoon from Lexington, Kentucky. So I'm a person in long-term recovery, as you heard in the intro. So certainly drug prevention is something that I'm personally vested in. And when I got this job at UK, I kind of did a needs assessment looking at the existing prevention efforts within the extension system in Kentucky and also just across the state. And what I found is almost to the letter exactly what Nate just read from the report, that the vast majority of the prevention programming we were doing wasn't evidence-based. Most of it really probably wasn't even research-informed by the loosest definition, and some of them were stigmatizing and might have been doing harm. So I realized that really what was going to be important for our state was to bring an evidence-based program. So I started doing some research. I found Botman Life Skills first, and I found the 100 papers that had been published on it, and saw that it had a really strong evidence base. So first we wrote for a SAMHSA ROTA grant, which are Rural Opioid Technical Assistance grants, to bring just Botman Life Skills. And then we were contacted by Greg and his team at ISU and invited to be sub-recipients on a subsequent ROTA to implement all of Prosper. And so that's kind of how we got to where we are today.
Great. So, so Greg talked briefly about the state management team, and I know you're really involved with the state management team in Kentucky. Can you tell me what the role of Kentucky's state management team is in supporting community prevention efforts? So how do you interface with local communities and support them?
Yeah, definitely. Thank you for that question. I think for me, the SMT reminds me a lot of a board of directors. So their primary role is oversight. And I run a nonprofit in Lexington called Voices of Hope. And when we were building our board of directors, you know, we're trying to think strategically about who are we inviting to the table and why, what resources do they bring, what connections do they bring. We kind of brought the same thought process to the state management team. So we included some folks within Extension who would understand sort of the way that the Prosper would be implemented on the ground. But then I also included folks like, for instance, Dr. Melinda Ickes is a professor here at UK who's not only a prevention expert, but also writes lots of grants around prevention. Because what we really wanted from our SMT was to enhance the sustainability focus. It takes a tremendous amount of effort, as I'm sure all of you all know, to procure grant dollars. And it didn't really make sense to be trying to write for this grant year after year to try to, you know, do prevention for one cohort of kids. We want this to be an ongoing effort, something that's kind of a fixture in the state of Kentucky. And if there is something that Prosper is great at, it is that infrastructure that really supports long-term efforts.
All right, sounds great. So, you know, as you well know, communities often vary in their approaches to promoting youth and family resilience. So, you know, for some, Prosper would fit really well within those existing efforts. For others, perhaps not. So, yeah, how do you navigate that in Kentucky? And what is the process by which those communities who might be initially interested in Prosper connect with you and the state management team?
Yeah, that's a great question. I would start by saying Prosper is an undertaking, not a burden, but it is an undertaking, and it's, I think, important that everyone be informed consumers about that. It's time intensive, it's resource intensive, and so one of the things that I've learned from this experience is you certainly need to have the investment of everybody on your team. Your agents need to understand what the time investment is going to be, what their workload is going to look like. You need a good technical assistance provider. We're fortunate to have the best at Kentucky, and SMT members who will engage, because you're really going to need that support in order to be able to implement Prosper. In order to kind of identify counties where we could implement Prosper, I actually hopped onto one of our agent meetings and kind of pitched what Prosper was and why it would be valuable. And then we started doing one-on-ones in those communities to talk them through really what does this look like? What's kind of the full weight of this infrastructure that we're going to be implementing, and what will it look like on the ground? And we had some counties say to us that they already had existing prevention efforts that they felt like we couldn't do kind of correspondingly with Prosper. And I understand that, and I think in some cases that's certainly true. In most cases it was disappointing to me, because I know that what Prosper offers is more effective in terms of quality and fidelity than a lot of these other programs. Some other states came to us and simply said, we don't have the time and the effort, the resources available. And that, I think, is a reasonable answer for sure, because as I said, it is an undertaking, but you know, you have so many meetings between your state management team and your technical assistance provider, and between the technical assistance provider and the local teams. And we have monthly SMT meetings. I meet with Greg on a bi-weekly basis, and you know, it's an immense amount of investment, but that's where the fidelity comes from, and that's where the quality comes from. And I have become such a believer in Prosper. I'm an evangelist now for Prosper. I shout it from the rooftops, and just really grateful that we were able to bring it to Kentucky.
Great, thanks, Alex. So, so we've heard from Greg regarding how the Prosper National Organization supports this work, and how the state management team, at least in Kentucky, can support the work in local Kentucky communities. Now I'd like to ask Joy what her experience has been like as a Prosper community in Colorado. Joy, you were involved in a pilot project that brought Prosper to Yuma County, and it's the same pilot project, I think, that brought Prosper to Kentucky as well, that Alex referred to earlier. Now, as you well know, in prevention, you know, one size does not fit all. So what made Prosper a good fit in Yuma County?
Well, I think there were several reasons, but kind of three main ones. And I would say one was just the limited resources that we have in general in our county to address behavioral health and substance misuse issues, and even a more limited amount of programs that are targeted towards those middle school age students and families. So I think that was one reason. I think the second reason is Prosper is, you know, it's universal. It doesn't just target a specific group, and when it addresses everyone, I think that's appealing and sometimes more comfortable for people, especially in really small towns or rural areas where, you know, everyone knows everyone. So it kind of helps, I think, alleviate that stigma, and everybody knows it's important for us all to learn and be stronger and healthier families and youth. And then the third reason, we had kind of a real focus with our local community coalition. They'd identified behavioral health and substance prevention issues as a concern. And so I think there was really a readiness and a willingness from community members and organizations to support this effort. And for me, Prosper has been, it's been really instrumental in bringing some new people to the table who Extension haven't traditionally worked with, but those who, you know, have the same passion to strengthen our community and the families in this capacity.
Nice. Okay. Alex talked about this being, you know, relatively resource intensive. So what were some of the resources that you needed to ensure that Yuma County was ready to adopt Prosper and had the capacity to do so?
Well, several people will know that initially it was, you know, information. I was not familiar with Prosper or what it entailed, and I asked a lot of questions. So, and there were people always willing to answer those. So that was definitely a resource that I needed, was just some information about Prosper itself. The training that Iowa State provides, you know, once I had agreed to pilot this, was really helpful. And the connections with CSU campus faculty that were involved in Prosper, all of those things kind of helped me through those steps in determining if it was a good fit. And then, of course, there's always, you know, that need for, of course, monetary resources and marketing materials and those sorts of things. And I think Alex, you know, stated this too. There's an investment in time, so you really need time to connect with those potential team members and community partners, time to present, you know, and just create an awareness about Prosper in general to your community. So those were all some kind of general resources that I needed up front.
Great. As an extension agent or as extension agents, you'll have a lot on your plates. So how do you find the time to be involved in Prosper on top of everything else that you're doing in your county? And do you have any advice for your extension colleagues who might be interested in learning a little bit more about Prosper and how it might fit in their community?
Yes, so as far as the time commitment and how I found the time, the pandemic actually was a kind of a blessing in disguise in this case, and I wasn't able to do the normal programming I'd been doing, so it really allowed me time to focus on developing our local team and helping to implement life skills and really get the ball rolling for Prosper. And of course, that's, you know, not something I wish on anybody that's looking at implementing Prosper in the future, but that kind of was the key for me, was just kind of having some time to focus on implementation. The other key is really having that strong support system. And I have a, you know, wonderful local team. We're fairly new, but I have a really strong local team, and they're willing to, you know, take on those tasks and roles to support Prosper. And the other support systems in place through our technical assistant provider, CSU, Iowa State. I've never felt like I'm going it alone or that I don't have people available to help me, and that's been really a key part of making this successful and allowing me to be able to fit that into my schedule. As far as advice, you know, I think Alex referred to this too. It is an investment in time. So agents who are interested might, you know, really need to be thinking about, you know, creatively finding ways to, you know, assist with some other programs or spinning off some of those existing things, or maybe some grant funding that can buy out part of your time, partnering with another colleague. You know, there's definitely ways of making it work. And I think if there's, you know, any questions, there's, you know, all of us at all levels that can help provide information. And for me, I feel like it is an investment in time, but I think it's a very valuable investment in time. And I'm really excited to see the impacts that we'll have in our community.
Great, thanks, Joy. So that was it for the formal Q&A questions that I had for our guest today. There's been a couple of questions that have popped up in the chat, so feel free if you have any questions to drop those in the chat. I'll start with a question that I think is really, really important and I think is relevant to all three of you. So maybe I'll ask this question in different ways to all three of you. This question is, I guess maybe we'll start with Greg on this. How does the Prosper Network organization support extension agents directly or indirectly on shifting that mindset from the traditional work, agricultural, 4-H programming, et cetera, to substance misuse prevention?
Thanks. I love the question because it illustrates something when we think about what exactly these things are. And they specifically mentioned 4-H program and then mentioned substance misuse prevention. And sometimes we refer to these things in our world as silos. So we think of this one over here and this one over here. But what Prosper actually is it's a combination of these two. The programs that you're implementing definitely achieve some of the same goals that your 4-H programming does. Okay, we're looking for youth programs that help develop youth. For instance, life skills is not just 15 weeks of talking about drugs. It's a lot of stuff about different skills. It's a lot of different activities. So there's things in there that don't change the primary goals that you're trying to achieve in extension. So I would say from the standpoint of how do we overcome this, it's to educate people about exactly what Prosper is and how it fits into existing roles and the existing structure, as opposed to presenting it as something completely new. If you look at Prosper outcomes, I specifically talked about substance abuse, but there are so many family related and so many youth related that are outside of substance misuse also. And we can provide a sheet for that. And it's also on our Prosper website where we have a lot of the evidence, outside of necessarily substance misuse.
Nice. So, the national organization can support local agents in this way. The state management team can also do that. So, Alex, how have you in Kentucky supported local agents, extension professionals who are making that shift?
Yeah, it really is a great question. And at Kentucky, we focused a lot on stigma reduction in education, and not just in the community at large, but actually within, internally within Extension. I think a lot of folks have the kind of perspective that in order to do drug prevention programming, you've got to be talking about drugs. And so we spend a lot of time helping them understand that when you're working on nutrition and holistic wellness in general, what you're doing is prevention. And so I think that in part has made them a little more comfortable. And then we spent some time doing some stigma reduction strategies, bringing in speakers with lived experience in addiction, helping them understand kind of how people end up where they do. And I think the net result of that was that it was really encouraging for the agents to see that they didn't have to be drug experts. They didn't have to do any new training in order to be doing this work. I mean, of course you do for Prosper, but in order to do prevention work in general, it didn't warrant some new training. As Greg said, it really is a continuation of the work that they do every day. So
then, Joy, you have experienced this transition over the past couple of years. How has that transition gone? And going from, in your bio, I referred to you mentioned that you traditionally done more of the nutrition and that kind of stuff. How has that transition to behavioral health work for you?
Well, I think it's a lot what Alex and Greg alluded to too. And I was a little apprehensive and nervous at first because that wasn't, not my wheelhouse. A lot of programming efforts had been related to nutrition and health for me throughout my career. So I was a little hesitant, but just like they said, it's very much what we do every day. It's just, maybe a different program and a little different spin on it, but it truly is supporting youth and families like we do on a daily basis. And it's been an easy transition and a very, very positive one. So.
So we have a there we go. Sorry about that. So we have a question for Alex. What has been Kentucky's largest Prosper victory? And so that's for the first piece. And what has been the largest lesson learned from your community related to Prosper?
Another great question. So first, our biggest win, I would say probably has been implementing during COVID. COVID presented a lot of challenges. In particular, we had a disruption in one of the first counties where we were implementing, where they had positive cases and the kids were out of school, and it kind of disrupted the process. But that's where that whole infrastructure, that whole support structure that's built in for you is so helpful, because we really leaned on Greg and Cassandra and a lot of the folks at ISU to help us think about how can we make sure we still get this programming to the kids who need it. And then the biggest lesson learned, honestly, for me is the mere fact that school-based prevention programs can be effective. I think because of my personal experience and because of what I saw around the state, it made me sort of jaded about school-based programs. We did a lot of DARE in the state of Kentucky, knowing full well that it wasn't evidence-based. In fact, it's evidence-based not to work. To that extent, we have a researcher at University of Kentucky, Dr. Clayton, who did some of that research in our own school system. So we really knew that we needed to bring something that was evidence-based. And so it's made me a believer in school-based programming, that it can be done and it can be done well.
Great. Greg, did you want to piggyback off that?
Yeah, sure, because Alex brought up a great point, the COVID context of these programs. And I think to piggyback off the success of effectively implementing during COVID, we had this, we have work across many Prosper states, and a lot of those are trying to implement programs. So across, 10 states, everybody runs into the exact same program. Virtually the same thing was happening in 2020 in every place, as far as the rules, mandates, lockdowns, things like that. So what was so beautiful about the network is we had this just unbelievable hurdle to overcome, but we were able to do that with the support of all these different agencies. So if somebody heard something or they talked to the developer, can I adapt this? Can I do that? Can we do this online? We would get that information and disseminate that across the network. So in what I feel like was a very quick manner, we were able to start building decision matrices that would help. Hey, can you do this? Well, if this happens, if they have these lockdowns, should I implement a program this way? Should I call a developer? Should I reschedule? What should I do? And we were able to get that out to the states pretty quick. And I don't think that would have happened had we not had that whole Prosper network. And that's where those people on the ground were able to provide so much support. The people like Joy, in her state or in Colorado, she was probably helping people in other states just by providing information of how she was doing things in Colorado. And that's sort of the beauty that we saw and the silver lining that we saw during COVID.
Thank you both on that one. So this is a question probably for Greg and maybe for Alex. So evidence-based sometimes comes across as feeling rigid, right? You've got this evidence-based program. The evidence is based on a program that's been implemented a certain way. So how much can SFP 10-14 or maybe even LST for that matter be adapted for local needs? Are there best practices for adaptation that is okay with Prosper? I guess maybe Greg.
Yep, and I have a real quick, easy answer. Ask the developer. What we always tell them is go to the developer. I feel like I know the two programs very well. I have people on our staff that know it a lot better than I do. However, for adaptations, we always say go directly to the developer. One of the reasons the Prosper programs were selected for Prosper is because of the feedback and response, and that you can directly contact the developer and get answers from them. So, hats off to the folks, the developers for Botman Life Skills and SFP 10 to 14. But yeah, that's the answer. That is a truth, though. The research is very specific to implement a program a specific way, so it can seem rigid. So that is part of the conversations that you have to have with your community. And what's really cool about Prosper is that I didn't even get into, we have hundreds of different tools. Almost every problem that's come up, we've developed a tool for. So we actually have some tools for talking to people if they're worried about programs being too rigid or this way or that way or can't do this. We have talking points and information that you can put out to them.
Great, thank you, Bo. Okay, so this question is for both Alex and Joy. Here, let's see here. Can you tell us what the lessons you've learned in gathering support and recruiting team members? What has been successful for those efforts? Maybe we'll go with Joy first, and then we'll toss it over to Alex.
Well, I would say one is I think just making those connections with existing groups and people that have an interest in this type of work, in this these topic areas. Honestly, it truly was not difficult for me. I think there was just such a need and an interest that people jumped on board and have been great. And I think there's different layers of support too for Prosper. So you have that kind of core team, and then kind of they have kind of a target, right, that extends from that local team. And I feel like it's really not been a difficult process to find people who want to serve on that local team, as well as others who are willing to be supportive in other ways. So that's not a very good answer, I know, but I just think when you share what it's about and the impact it can have, and and your community's ready for that, if you build it, they will come, right?
Thanks, Joy. How about you, Alex?
Yeah, just piggybacking off of that, in my experience, mental health and substance use prevention, recovery, all the services tend to be really siloed, and the right hand doesn't know what the left hand's doing, and oftentimes we're duplicating things. And so one of the things that was really helpful to us in building our teams was going to existing community coalitions. And I imagine most states have community coalitions across the state. We have ASAP boards, Agency for Substance Abuse Policy, and it was kind of a helpful thing to be able to leverage, to already have a foot in the door. And then the other thing I would say is I do think it's just important to be transparent with the folks you're inviting about what their commitment will be. Because as I said, in order for the program to be done properly and to be done well, it is an investment. And I think it's just helpful for the folks you're trying to invite to really have a solid understanding of what's going to be expected of them.
Thank you, Alex. So there's a related question around data and the use of data when recruiting team members. So the question is, do you find that people are already aware of data around substance use, or do you need to be prepared in sharing those data and about the importance of prevention? I guess maybe Alex, we can go with you.
Yeah, in my experience, folks are not really familiar with the data per se. I think we're pretty well aware, at least in my state, that we have a problem, an opioid overdose epidemic and widespread addiction problems. But I don't know to what extent folks understand the nature of the problem, and I don't know to what extent folks draw a connection to the capacity that prevention programs have for impacting things like overdose rates, like Greg talked about. So I do think there's value in that, always adding a little extra context to help people really understand why Prosper could be so critical in their community.
Okay, great. All right, so the last question that I have in the chat is for Joy. Joy, what adaptations within fidelity to the Prosper approach, of course, are needed for Prosper to be successful in Colorado?
Well, I guess I haven't really ran across any, very specific adaptations. I think it's broad enough that it fits a lot of different areas and communities. So I can't think of anything that was really major that we had to adapt.
Great. Sounds like a great fit for Yuma County then. Okay, well, unless there are any last second questions, that's all the questions that I have. I want to thank everyone on this panel so much for your insightful commentary and responses to the Q&A. If you're interested, anybody in the audience, if you're interested in learning more about how Prosper can fit in your communities, please email us at prevention@colorado-state.edu. I put the email address in the chat box for you. And if you're interested in viewing any of our previous prevention extension casts, please visit our website, and I dropped that into the chat as well. We've had chats about casts about vaping, mental health, and ACEs in the context of COVID-19, aging and engaging our aging population in Colorado, among others. So with that, I will thank all of our guests and thank all of the attendees for joining us today. And I hope you found it useful information, and we will see you in another couple of months for our next Prevention Extension Cast. Take care, everybody.